Thank you very much for your kind wishes. What was really kind and full of good wishes was all the turnout this weekend that our friends in the groups put out to observe the 9 years since the ACA was signed into law, delivering a pillar of health and economic security that stands alongside Medicare, Medicaid, and Social Security as pillars of economic and health security for America's working families. Last night, in federal court, the Justice Department of the Trump administration, you think they'd have more to do, decided not only to try to destroy protections for pre-existing conditions, but to tear down every last benefit and protection the ACA affords. The GOP will never stop trying to destroy the affordable health care of America's families. I always think of Mr. Clyburn and John Lewis when they quote Martin Luther King when he talks about, of all the injustices, the most inhumane is the inequality of health care. And the Department of Justice becomes the Department of Injustice when it wants to tear down health care benefits. Because, as Dr. King said, people could die. People could die. In this House, with a Democratic majority, we're here to strengthen those protections and to lower health care costs further. Because this House, this Democratic House, is for the people. Today, under the leadership of our three distinguished chairmen, Mr. Pallone of Energy and Commerce, Mr. Scott of Education and Labor, and Mr. Neal of Ways and Means Committee, the three committees of jurisdiction, we're going forward with the Protecting the Pre-Existing Condition and Making Health Care More Affordable Act. That's a line for applause. They and our other members and members of our freshman class will be speaking more to the particulars of the legislation, but suffice to say it lowers health care insurance premiums, stops junk plans, strengthens protections for pre-existing conditions, and reverses the GOP health care sabotage. Protecting and strengthening health care is why Democrats are here on day one, the first day as we were sworn in the 116th Congress. The House voted to intervene against Republicans' monstrous health care lawsuit. We continue to work on legislation to lower prescription drug prices for seniors and families across America. And today, led by our freshmen, we are taking another big step forward to lower health care costs for the American people. And with that, I'm pleased to yield to the distinguished House Democratic leader, Mr. Hoyer.
Thank you very much, Madam Speaker, and thank you for your leadership role in assuring that we extended the affordable, quality health care to all Americans. You deserve great credit. The American people, by significant numbers, support the Affordable Care Act. They didn't always do that, but when they found out what they might lose, they became convinced that what they had gotten was important to them and to their families. Last Congress, Republicans passed a bill that would repeal the Affordable Care Act, raising health care costs and putting Americans with pre-existing conditions at great risk. When that effort failed, the Trump administration has made every effort to sabotage the law, undermine the benefits, undermine the security that the American people had. Just yesterday, as the Speaker indicated, the Trump administration filed a brief in the Texas case against the Affordable Care Act, indicating that it supports eliminating protections for pre-existing conditions and all of the other protections in the law that have benefited millions of Americans, including expansion of coverage for 20 million Americans. When Democrats ran on a platform of increasing access to quality health coverage and protecting against discrimination in accessing coverage and care, Americans responded. We had an election, not a poll. We had an election. And the Americans raised their hand and said, we want the Affordable Care Act protected. Therefore, we're going to vote for the party that says it will protect and preserve and, yes, even expand the Affordable Care Act. Americans responded by sending Democrats like Andy Kim, Angie Craig, Lauren Underwood, and Susan Wild to Congress to protect and expand the Affordable Care Act. The first action the Democratic majority took was to protect those with pre-existing conditions. And we're going to continue to fight until those protections are real and reliable. Now, Democrats are continuing to deliver on our promises by introducing legislation to reverse the Trump administration's health care sabotage, protect those with pre-existing conditions, and make health insurance more affordable. Ladies and gentlemen, let me remind all of you about the Trump campaign for president, in which he said he wanted to repeal the Affordable Care Act and offer a bill which would provide for health care coverage for everybody at lower cost and better quality. As soon as he sends that bill down to the Congress, I'm voting for it. But there has been no such bill coming either from the administration or from the Republicans in Congress. I am therefore proud to join my colleagues in introducing this bill. The Affordable Care Act wasn't perfect, but it brought real reforms to our health care system that Americans do not want to see undone. Republicans, listen. Americans do not want to see the protections undone. With this bill we are introducing today, House Democrats are building on those reforms to make sure that every American has access to quality, affordable health care. I am pleased now to yield to another fighter in the successful effort to pass the Affordable Care Act, my friend from South Carolina, the Majority Whip, Jim Clyburn.
Thank you very much. Thank you. Thank you. Thank you, Leader Hoyer. Thank you, Speaker Pelosi, for your tremendous leadership, and thanks to all of my colleagues here. On the day that we passed the Affordable Care Act, if you recall, it was a Sunday, and we passed the bill late at night. I took to the floor that day, and I referred to the Affordable Care Act as a Civil Rights Act of the 21st century. I said that because of that 1966 speech that Martin Luther King Jr. Gave that the Speaker just alluded to. I said that because what we were doing with that law was outlawing discrimination against people who might get sick, and also against people who may come into this world with a pre-existing condition. What we were saying, that a child born with diabetes ought not be denied insurance coverage on his or her family's insurance policy. What that said was a woman with breast cancer or a man with prostate cancer should not be allowed to be kicked off of the insurance policies when they start getting treatments. And what we were saying was that we are going to make the quality of life issues, foremost among them health care, accessible and affordable for all American citizens. We took that message to the people last year, and they responded by rewarding us with a very handsome and beautiful victory. And I want to thank those new members who ran on this issue and came to this body to offer leadership to make sure that we accomplished that which we promised the American people. When I got started in this business years ago, a state senator of 50 years came into my office and said to me, "Now, I want you, the next time you run, you tell the people what you're going to do for them. And by God, when you get elected, you do it. And then you go back to them and tell them that you've done it." So we're here today to tell the American people that we kept our promise. We did it, and we are saying to our friends on the other side to join us in making sure that we keep those promises to the American people. The president made the promise that he would protect people with pre-existing conditions. He's breaking that promise with the lawsuit they filed last night, and we are going to remind the American people time and time again of that broken promise, which is fundamental to everything. Without good health care, you aren't going to get a good student. Without good health care, you aren't going to get a good worker on any job. Without good health care, you're not going to get a good, solid American citizen. And that's what we're in the business of doing, building good, solid American citizens. And with that, I am pleased to yield to my friend from New Jersey, Mr. Pallone.
I'm glad I'm following Jim Clyburn because I want to follow up on what he said. He talked about President Trump's broken promises and what we as Democrats are going to do to live up to our promises. So yesterday, once again, President Trump, through the Justice Department, announced that they want to repeal the Affordable Care Act through the courts, even though they said that, they were going to make sure that Americans had good health care. They're saying outright, we're going to we want the courts to repeal the Affordable Care Act, which means that people will not get health insurance. On the other hand, what we're going to do tomorrow in the Energy and Commerce Committee and the Health Subcommittee is move legislation that would actually act on our promise, which is to make sure that people are protected who have pre-existing conditions. And then I'm going to have Neil follow me to talk about the affordability aspect. I was outraged when I saw last night that the AG had filed this filing saying that he was going to support repeal. It's outrageous because I remember I was there, 6-7 years ago when we drafted the Affordable Care Act, and people forget that before that, if you had a pre-existing condition, you were not able to get health insurance. If you didn't get it on the job because you had to go buy it on the individual market, you were subject to all kinds of discriminatory practices, lifetime limits, annual limits on, what kind of insurance you would get. And then if you wanted to buy insurance, a lot of the insurance that might be available to you because of your pre-existing condition was junk that didn't cover everything. They were selling insurance in some states, I remember in North Carolina, that didn't include hospitalization. As far as I'm concerned, if I don't have hospitalization, I don't have health insurance. I mean, this is the type of thing that was going on. And so what we're doing is we have this comprehensive bill that's being introduced today, but we've taken out about 6 different parts of that that specifically are under the Energy and Commerce jurisdiction, and we're going to move them tomorrow. And one will guarantee that you can't sell those junk plans and that you can't discriminate in the way that was done with pre-existing conditions and other things. Now, there's 2 other bills, 2 other things that the president has sabotaged, and that is the outreach, right? 90% of the money for the outreach, to tell people what the insurance is about, to have navigators, to explain, that's all been eliminated. We are going to bring that back. And then the last thing we're going to do, and Mr. Kim and Andrew Craig are the sponsors of those bills that would say that if you want to set up a state-crafted marketplace, we will help you do that because it is important that states be able to tailor the marketplace to their individual state because that makes for better health insurance as well. Now, the last thing I wanted to say is that the Energy and Commerce Committee just recently launched an investigation of these junk plans. Because what the Republicans say, and it's false, is, well, it's okay, you make your own choice, you buy a junk plan, that's on you. Well, the fact is these things are misleading. There's all kinds of terrible practices out there. They're pretending as if these plans actually cover things that they do not. And so we're going to get to the bottom of that. But now I'd like to introduce Rich Neal. Chairman Neal is going to talk about the affordability aspect and others. Thank you, Rich.
Thanks, Frank. Thanks, Frank, very much. One of the nice things about being chairman of the Ways and Means Committee is that other members lay out the plan and they say, and now we're going to hear from Chairman Neal and how we're going to pay for it. To the Speaker and to the two leaders here, last night, I think in New Orleans, the intentions of the Trump administration were unmasked. They told us in the aftermath of the election that they believed that the ban on pre-existing condition was sacrosanct. Remember the other parts of the Affordable Care Act, keeping 26-year-olds on their parents' health insurance? How about putting a cap on out-of-pocket expenses? These were all very important components of a well-crafted, well-thought-out plan. And the proposal that we have in front of us today with the leadership of the Speaker is that we're delivering on our promises to stabilize health care costs for working Americans. We're going to undo the sabotage of the Affordable Care Act, and we're going to improve access to comprehensive care. So the bill makes premium tax credits available to more Americans, which improves health care affordability and allows more individuals and families to qualify for those credits that will, in the end, lower premiums and out-of-pocket expenses. Our proposal ensures that families who don't have affordable coverage through their employer can still qualify for tax credits in the marketplace. What that means is, essentially, if you choose an arbitrary number, a family of 4, they would qualify for income based up to $96,000 for tax credits. For the individual, up to $46,000 for tax credits. Now, I'm just going to close on a note that I'm very proud of. This is what happens when you have a state where people want to make the Affordable Care Act work. Let me give you a pretty stunning statistic from Massachusetts. 100% of the children in Massachusetts are covered. And 97% of the adults in Massachusetts are covered. And guess what? In terms of consumer satisfaction, it regularly polls in the high 70s. Thank you all very much.
I'm sorry, Bobby Scott.
I was so busy with my tax credits. A good friend, Chairman Bobby Scott.
Thank you, Chairman Neal. Ladies and gentlemen, when it comes to health care, there's an essential difference between the two parties. Republicans say they support protections for patients with pre-existing conditions, and Democrats actually advance legislation to protect patients with pre-existing conditions. In state legislatures, in Congress, in the White House, and in the courts, Republicans have worked tirelessly to undermine or completely eliminate patient protections under the Affordable Care Act. Last year, one Republican candidate was so bold as to declare support for patient protections, including those with pre-existing conditions, while simultaneously joining a lawsuit to get rid of all those protections. The American people are demanding that we support access to affordable health care, not just in words, but in deeds. That's what the House Democrats are doing today. By stopping the expansion of junk plans, this bill takes an important step towards protecting people with pre-existing conditions and lowering health care costs for millions of families across the country. The bill also protects consumers from the administration's harmful proposals to erode the essential benefits package that ensure people have access to quality health care, including maternity care, and substance abuse disorders. And we cannot forget what the situation was before the Affordable Care Act passed. Costs were going through the roof. Those with pre-existing conditions couldn't get insurance, and the number of people with insurance was dropping every day. We've turned the corner, and I look forward to joining my colleagues to advance this and other solutions that ensure that people with pre-existing conditions can access the care they need to live a healthy and fulfilling lives. It's now my pleasure to introduce my colleague from Illinois, member of the Education and Labor Committee, and a health care professional herself, Congresswoman Lauren Underwood.
Thank you, Chairman Scott. I come to this from a little different perspective than others. I'm a nurse, and I have a pre-existing condition. So as we are all here talking about how to make health care better and more affordable for people, know that this is personal for me. That's why I'm so proud to be here today as our caucus works to protect people with pre-existing conditions, lower health care costs for consumers, and reverse partisan actions designed to weaken the Affordable Care Act. As a part of that, I'm introducing legislation to help reduce premiums for those who purchase private health plans through the marketplace. It would cut premiums by hundreds or even thousands of dollars per year for more than 10 million people. It does this by increasing the tax credits that people get to make premiums more affordable and allowing more people to qualify for those tax credits. It would give 9 million uninsured Americans access to lower cost coverage while reducing premiums for an additional 10 million Americans. I thank my colleagues for their hard work in this effort to make quality health insurance more affordable. And I'd like to introduce my colleague from Pennsylvania, Ms. Susan Wiles.
Good afternoon. Thank you, everyone, and thank you, Speaker Pelosi, for this opportunity to say a few words. I want to express my belief in the core moral principle that everyone standing here today has already expressed, that quality, affordable health care is the right of every child, woman, and man in our country, not a privilege just for those fortunate enough to have it. As part of our efforts to make this principle a reality, we need to build on the successes of the ACA and ensure that every American can get health coverage, protect people with pre-existing conditions, and lower the rising cost of health care. I'm proud that this effort includes a bill that I've put forward, the Family Health Care Affordability Act, a bill to fix the ACA's so-called family glitch. This glitch in the system has prevented some workers from being able to expand their employer-provided insurance to their families by disqualifying them for the subsidies they need to be able to afford coverage for their spouse and their children. My bill is a small fix to a big problem for many working families. This, alongside our sweeping legislation to stabilize and strengthen the ACA and protect people with pre-existing conditions, can help every family across our nation get health insurance. As a representative of a district with as many Republicans and independents as Democrats, I can tell you this: it is not a partisan issue. When my constituents gather around their kitchen tables, they aren't talking about party or ideology. They are talking about how they're going to afford their premiums this month. They're worried about the same unsustainable health care costs and gaps in coverage. On behalf of working families in my community and yours, let's work together to improve the lives of millions of Americans by building on the promise of the Affordable Care Act and strengthening our health care system. Thank you, and at this point I turn it over to Representative Angie Craig from the great state of Minnesota.
Minnesota, I'm sorry. Thank you so much, Susan. Hello, my name is Representative Angie Craig, and I represent Minnesota's 2nd Congressional District. I also come at this as a woman now who grew up as a child without access to health insurance for part of my childhood in my own family. I spent 25 years of my career before I ran for Congress in 2018 working in different healthcare manufacturing companies. That's why when voters told me, and when my constituents tell me today, that their number one concern when they sit across at the kitchen table is the cost of health care in this country, it resonates. I know what it's like to grow up in a household where the box of bills piles up and the worry grows. See, farmers in Zumbrota, they're paying $24,000 a year in the individual marketplace with a $12,000 deductible. In my district, 51% of the non-elderly have a pre-existing condition, one of the highest in the country. See, this explains the heart of the problem. If health care isn't affordable, it isn't accessible to Minnesotans and to Americans. That's why I've introduced the State Health Care Premium Reduction Act. to lower the cost of health insurance premiums in the individual marketplace by 10%, taking an immediate step to make health care more affordable for more Americans. We can't wait in this country any longer. We can't wait for the politics to be right. We need our colleagues to work on behalf of the American people. My bill is only part of the solution. That's why I'm grateful to be standing here today and working with my colleagues to not only address the cost of health insurance, but also to ensure that no one receives unfair treatment because of a pre-existing condition. Thank you so much, and I'd now like to introduce my fellow Congressman, Andy Kim.
My name is Andy Kim, and I'm the Congressman of the New Jersey 3rd Congressional District. I also stand before you as a son of a polio survivor. I stand before you as a father to 2 baby boys whose health I worry about every single day. I stand before you as a neighbor to so many people in New Jersey who worry about their families, worry about the money in their pockets, especially when they have concerns about their health. I come today bearing a message from my district that these issues about health care and prescription drugs and pre-existing conditions, that these aren't politics to my constituents. It's personal. That these issues are ones that affect them every single day and the ones that I hear about at town halls and events across my district. When I'm asked in my district, what is going to be the measure by which I judge my success here in the halls of Congress? What I tell them is that we live in an age right now when 40% of Americans cannot handle a $400 emergency. And I will judge my success here by my ability to lower that number, to lower the number of Americans who live with that level of fragility in their life that they should not have to experience. And that is why I introduced the SAVE Act, a bipartisan effort for us to be able to understand how we can give states the control to be able to lower these costs. For states to be able to set up state exchanges which are proven to allow costs to be able to drop and give states greater control of the health care plans that are afforded to the people within those states. This is a bipartisan effort that we are moving forward, and I am proud to be able to introduce this to Congress. And I do that not only as the Congressman of the New Jersey 3rd, not only as a colleague to these incredible people who are committed to a better health care system in this country, but as a son, as a father, and as a neighbor to so many people who deserve better. Thank you.
As you can see, our distinguished chairs of the committees are prepared to end the sabotage and improve the Affordable Care Act. But our new members, the members of the freshman class, have come in with their own ideas on how to make Affordable Care Act even better and more serviceable to the people that we serve. Thank you. Thank you, Angie Craig. Thank you, Lauren Underwood. Thank you, Andy Kim. And thank you, Susan Wild. But her family glitch legislation. When we fought for the Affordable Care Act, those of us who did, who are here, we did so with the idea, it doesn't have a very glamorous name, the Affordable Care Act, but we decided to just call it affordable because that was the whole point. It was affordable care. And because people needed affordability, as has been said, in order to have accessibility. And of course, we wanted to be quality. And so here we are, these 9 years later, with the administration coming in with a lawsuit to eliminate this access to affordable care. I just want to make this one point. All during the campaign, the Republican candidates and the Republican incumbents were saying that they supported the pre-existing condition benefit, despite the fact that they had voted over and over and over again to repeal it. And we said, if you support it, then why don't you disassociate yourself from the lawsuit? Even one of the Senate races, one of the attorneys general in the lawsuit was saying he supported pre-existing conditions. So there's an inconsistency, if not an hypocrisy, here. Why would you mislead the American people that way? Why would you say you support the benefit of a pre-existing condition when you voted to eliminate it and now overwhelmingly are part of a lawsuit to eliminate it and support an administration who wants to do away with the whole bill? The whole bill not only provided 20 million people with affordable care who didn't have care, it provided better benefits for over 150 million families in America by eliminating, as Mr. Pallone said earlier, by eliminating the pre-existing condition obstacle, by eliminating the limitations, the caps, the annual and lifetime caps. The list goes on about how the benefits were improved and how we put it onto a path of affordability. So what they're doing is very destructive. We won't let them do that, and we will fight them in the Congress and in the courts for the people. That is what we promised in the campaign: for the people, lower health care costs. This is one aspect of it, more to come. I want to thank our freshmen for being who they are, coming to the Congress with fresh ideas on how to make things better, very closely connected to their constituents, fresh from the trenches. Thank you, Angie Craig. Thank you, Lauren Underwood. Thank you, Andy Kim. Thank you, Susan Wild. And I know my distinguished chairman and leadership thank them as well. And I want to make a special note for the outside groups. We would never have been able to pass the Affordable Care Act with just our inside maneuvering. It was the outside mobilization that made the success possible. Lincoln said, public sentiment is everything. They went out there. They saved the Affordable Care Act over this past 2 years by 10,000 events. 10,000 events across the nation. And last night when I spoke to them on the phone, didn't know what, we have a regular call, didn't know what subject might come up. Healthcare, 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 healthcare. So let us thank them. Thank you all very, very much. And thank all of you. Thank you, my colleagues. Thank you. Sister Simone. Let us acknowledge Sister Simone. Sister Simone says we have to say everything 3 times. Healthcare, healthcare, healthcare. Right?